now in last few years we are seeing more patients who in the age group of 30s or 40s who are coming with severe heart diseases, heart attacks, and they have blockages in the blood vessels which supply the artery. People who are introvert or who are not able to express themselves, especially males, they have a lot of psychological stress building up, and that indirectly increases their blood pressure.
Hi guys, this is Minidevan and you're watching HealthSite and India.com. Today we have with us Dr. Upendru Bhalirao, consultant cardiac surgeon. Hi sir, how are you?
Hello, I'm fine. How are you?
All good sir. Sir, to begin with, I think the very first question that comes to my mind is what really is World Heart Day and what is its significance? If you could share it with our audience.
So World Heart Day is a concept which started in year of 2000, where World Health Federation have come up with a day to mark the awareness of coronary artery disease and heart diseases amongst the general population. So it's an opportunity for all of us to spread the awareness about the heart diseases, its prevention, its diagnosis and cure.
Okay. Having said that, sir, I think another important question, especially in current times, is that heart attacks have been now, more commonly observed in youngsters as compared to what they were probably a decade back, especially considering the recent cases. And, there have been names which have been so prominent, like Siddharth Shukla and so many other people, due to which suddenly this has been the talk of the town. So, what is the reason behind this?
Yes, I agree, because now in last few years we are seeing more patients who in the age group of 30s or 40s who are coming with severe heart diseases, heart attacks, and they have blockages in the blood vessels which supply the artery. The prime reason behind is the sedentary lifestyle, the overall increase in obesity, the amount of tremendous stress that all of us are working under, and some of the habits like smoking, alcohol. This is all contributed to the increase in the heart disease in youngsters. Not to forget is the food habits that we have. So a lot of junk food, a lot of unhealthy food has caused severe amount of hypercholesterolemia, hyperhomocystinemia, and that has caused heart diseases in youngsters.
So, considering that food habits has a major impact to your heart health, so anything that one should keep in mind in order to increase the longevity of your heart's health, what should actually one consume? What should be the diet?
So important is to have a lot of natural food, is to avoid artificial foods with a lot of preservative, foods with a lot of sodium. So we need to restrict the amount of salt in our diet, not to take excess salt because it will increase in blood pressure. Second, we need to avoid a lot of fatty foods, which includes fried food, which includes red meat. That needs to be avoided. Milk and milk products are okay to have, but excess of cheese, excess of butter is increases the chances of you getting atherosclerosis and coronary artery disease. Having a large amount of green leafy vegetable, fresh fruit, nuts is important. We need to cut down on the carbs a bit and increase the protein content of diet. That will help us to have a good and healthy heart.
Also, there's this. I myself personally am very curious. We know that eye color, skin color, even sugar and diabetes can be genetic. But does
Yes.
genes and genetics matter on heart diseases as well?
Yes, it does. So some of us have a familial predisposition to have a coronary artery disease. That is because in some of the genetic disorder, the progression of atherosclerosis is very fast. That is why some heart disease can run in some families, and also diabetes and hypertension can have a familial component that can run in families. There are some hereditary pathologies which can cause increased cholesterol in the blood, like familial hypertriglyceridemia or familial lipoproteinemia. These are also contributory factors to have a familial heart disease. So yes, it do runs in families.
Okay. Also, there's this very interesting fact. Couple of researchers show that males are basically more prone to heart attacks as compared to women. So, firstly,
Correct.
is this true? If yes, then why?
Yes, males are more prone to heart attacks as compared to females. One is because the estrogen kind of gives a protective effect for the heart for females. So in general, we observe more incidence of heart attacks and heart diseases in men. But as the effect of estrogen goes down in a postmenopausal phase, females also have the same tendency as compared to males. So in a adult life, yes, males are more prone, but in an old age after 60s and 70s, both of them have the same importance.
Okay. Also, does emotions have any role to play in heart health or cardiovascular diseases?
Yes, indirectly does, because there are people who are introvert or who are not able to express themselves, especially males. They have a lot of psychological stress building up, and that indirectly increases their blood pressure and also has adverse effects. So yes, that is one more reason. If people are not able to speak out, if they have a lot of psychological stress undergoing, especially which we commonly see in males, they have more chances of developing a heart disease.
There are a lot of myths when it comes to symptoms, often people also confuse heart attacks with acidity. There has been
Yes.
instances wherein there have been deep acidity issues and there have been major pain in your heart's area, which people oftenly gets confused with heart attacks. So how to identify it? What is the basic difference between these symptoms?
So first of all, any pain which is crushing, throbbing type, which starts from the left side of the chest, which goes to the neck, jaw, or left arm, is classical of what we call as angina pectoris. But there are some sort of mimics also which can cause an angina. Like patients who have chronic cough can be a manifestation of cardiac asthma, and it can be a neck pain can be a symptom of angina. Back pain, shoulder pain, which is radiating from the left chest, also can be an angina misnomer. There are patients who have right coronary disease, who have pain which is slightly lower than the heart area, which is often misdiagnosed as hyperacidity symptoms, but it is actually a pain which is originating from heart. Some of these patients, they don't get acute onset anginal pain, but they get sort of a little bit of chest discomfort, little bit of palpitation, uneasiness, sweating. These are also symptoms which can be very serious of a heart disease. Shortness of breath is also an important symptom, that if the patient has decrease in his LV ejection fraction and the drainage of fluid up from the lungs is not adequate, and there is a decrease in the ventilation perfusion mismatch. So that is shortness of breath is also an important symptoms. Other symptoms can be a sensation of a blackout, or it can be a giddiness, or a severe amount of palpitation, swelling over the legs, not able to eat properly, feeling of exhaustion. So all these symptoms in part can contribute to indicate that they have a heart disease.
And since we're talking about the symptoms, what about the treatment? In terms of treatments, most oftenly heard treatment is bypass surgery. But what really goes into the entire process of treating cardiovascular diseases?
So the first thing is to achieve a good diagnosis. We need an echocardiogram to show what is the function of the ventricles, what is the function of the valve. We need an angiogram to decide whether which blood vessel has the blockages, what is the extent of the block, and what is the percentage of the blocks. Most of the mild to moderate coronary artery disease without any significant blockages in the coronary arteries are managed with the help of medication and lifestyle changes. If there are one or two blocks on the angiogram which are easily can be balloon dilated and can pass in a stent across it, angioplasty either is an emergency or is an elective procedure, is a fantastic method to achieve adequate blood flow by opening up the block and passing a metal stent across it. And now there are newer advances in stents which have come, which can give them a fantastic results. Patients who have pathology where the anatomy doesn't allow them to have a a stent being put in or angioplasty being done. And also they have multivessel coronary artery disease. One artery is blocked at 2-3 places. Such patients who have diabetics, who have a higher progression of atherosclerosis, these are patients who are candidate for something called as a bypass operation. What do we do in a bypass operation is the block stays as it is, but we make an alternative channel so that the part of the heart which was not receiving enough amount of blood through the blocked coronary artery gets the adequate amount of blood through the bypass graft that we are given to the patient.
Okay. Also, doctor, post-COVID, we have seen that the rate of heart diseases has also increased.
Yes.
Symptoms also shows heart-related problems. So, what impact COVID has created on heart's health?
So, as you know, COVID is known to cause microthrombi. That means it's known to give rise to clots in the small blood vessel. Now, the same happens at two places. It can give rise to clots in the blood vessels which are supplying the heart, that is coronary arteries. So, we have seen patients who are coming up with angina. We have seen patients who have been coming with heart attacks secondary to their COVID infection. We also saw a large number of patients who develop pulmonary embolism, like a blood clot in the blood vessels which are supplying their lung. Some of them requiring blood thinners, some of them are helped by thrombolysis, but some of them do require major surgeries like pulmonary endarterectomy. Third thing which we saw because of COVID is something called as arrhythmias, that is the increase in the heart rate or irregular heart rate secondary to their hypoxia that COVID causes in them. And we also saw something like a COVID-related cardiomyopathy. Like after COVID, these patients have significant decrease in their heart function, which has caused them to have a temporary or a long-term heart failure also. So yes, COVID has increased the chances of you having a heart disease, and some of them have recovered on its own, some of them still require medical treatment, and some of them have required procedures in the form of angioplasty or a bypass operation.
Okay. So anything, any tips or advices before you leave that you can share with our audiences in order to prevent heart-related diseases and in order to keep your heart's health, just healthy and long-lasting?
So first thing is to have a regular amount of moderate exercise, which is required. It will decrease your blood pressure, it will decrease your blood sugars, control your diabetes, it will maintain your physical activity. Second is to have a regular health checkup. Anyone who is above 35, we previously used to say above 50, but now we have gone down on limit to say 35, should have an annual health checkup, which should include echo, stress test, lipid profile, blood investigations, X-ray and ECG. We need to improve our diet, is to avoid all junk foods, excess fats, excess salt, excess sugar. Everyone should aim at having an optimum weight and say no to obesity. We need to control unhealthy habits like smoking and alcohol. And to decrease our psychological stress, everyone should have some sort of a stress relief, be it music, reading, writing, yoga, meditation. But we need to have our own space where we de-stress ourselves, so to keep our heart healthy.
Thank you so much, doctor. I think this has been great. People will go back home with lots and lots of valuable insights. So thank you for joining us today.
Thank you very much.
Thank you, doctor.